Discussing about breast lift and breast reduction surgery. Both the surgeries are surgeries with specific identities and performed in certain conditions where they have their special requirements. Breast lift is a surgery which is performed in post-pregnancy women or women of the older age where the breast has sagged down due to gravity and due to lactation, where there's a fat loss after lactation. In these conditions, the women might not need a volume reduction, she might just need a breast lift. We open up the breast and tuck in the available breast gland and the breast tissue to the posterior chest wall, and then redrape back the entire skin into its position. In this surgery, there will be a scar around the nipple and kind of a keyhole scar which is similar to breast reduction, but this surgery can be performed without reduction in the volume. The only main aim of the surgery is to give you a perkier and lifted breast. Breast reduction, on the other hand, is a surgery which is mostly used or performed in conditions where there is a heavy breast right from their adolescence time. In that situations, a heavy breast is always putting on weight onto the breast ligaments, the vertebra, and giving severe backaches to the patient. The weight on the breast ligaments causes a saggy breast over a period of time, and by the time the patient reaches their early 20s or mid 20s itself, they develop a saggy breast. This surgery is not a surgery very specifically designed for post-pregnancy women. This is for anybody who have just heavy breast and developed a sagging breast. In this surgery, we again open up the breast with a keyhole scar, excise all the extra fat and the breast tissue if needed, tuck the breast back into its position and give a kind of anchor to the posterior chest wall and redrape back the skin in around the breast. The breast kinds of sits into the draped skin. This also gives a perkier breast, but the main intention of doing this surgery is to reduce the volume of the breast and put the breast back into its position. Both the surgeries can be performed in different situations, and there's no comparison between both of them. They have to be specifically designed to the patient depending on their requirements. But one good thing about both the surgeries is that we will not be touching your breast gland, and it doesn't affect any future lactation if at all needed. If you feel you're a candidate for any of the above mentioned surgeries, kindly visit Eternelle Aesthetics for further details. Also share it with your female friends whom you feel is a good candidate for these surgeries, because this will transform their lives. Share and subscribe to Eternelle Aesthetics for further information on surgical procedures.